topic about therapy hypothermia of hospital cardiac arrest in children. I topic about therapy hypothermia of my name is arrest in children. Definition therapy hypothermia in school recommended. My name is adults after witnesses out of hospital cardiac arrest is recommended, but that all these after witnesses out of hospital cardiac arrest, but that about this intervention
Good evening and welcome to Healthy Discoveries, brought to you by the VCU Medical Center. I'm Mandy Sattler. Tonight's discovery is a cool new procedure that helps reduce complications and improve survival in patients who've had a cardiac arrest.
Well, he'd been at work all day and walked past the security where you walk in and turn the corner and tell me I just fell out on the floor.
After being resuscitated from a cardiac arrest on the steps of the courthouse, public defender Paul Wilhelm underwent a cooling procedure called therapeutic hypothermia.
We give the brain and the rest of the body time to reheal after the initial injury of the cardiac arrest. So the hypothermia tries to decrease the brain damage and improve overall survival in patients that have had a cardiac arrest.
The patient's body temperature is lowered to around 32 degrees Celsius for about 24 hours.
You can cool them from the inside out or from the outside in. We have used devices that wrap around the patient externally and bring their body temperature down from the outside in. And we are now using a device that is a catheter that's placed internally that quickly cools the body from the inside out.
Hypothermia improves survival after cardiac arrest, but continuous brainwave monitoring can improve it even more.
We have constant consultation with neurologists and neuropsychologists, speech therapists, occupational therapists, nutritionists, and we really take care of the whole person after the cardiac arrest to try and improve their outcomes.
What they did is the reason I'm here, and if I had been anywhere else, I wouldn't be here.
If you have any questions about therapeutic hypothermia or about your heart health in general, give us a call at 1-866-828-3627. We'll see you next time. Good night.
Application in nursing. We conduct this trial of the target temperature intervention at application in nursing. Hospital conduct this trial of the target temperature intervention after hospital cardiac arrest. Hospital involved children remaining unconscious after hospital cardiac arrest.
Cardiac arrest has a very high mortality rate, and it's due to a variety of reasons. The brain starts to undergo a degeneration, basically a self-destruction, where certain chemical processes start to take place, which accelerate cell death. From the time of arrest to the time you reestablish that circulation is what determines your survivability. By starting hypothermia, by reducing the body's core temperature, you actually stop the internal injury process that takes place on a chemical basis. How you institute hypothermia can vary. The main goal is to try to drop that temperature down to about 32 degrees Celsius within about 3 to 6 hours of the time of the arrest. That's your magic window of achieving that hypothermia. You happen to be picked up by an ambulance who is equipped and educated. A hypothermic cooling blanket could be applied. Ice packs placed into the high circulation areas, the axilla, the underarms, the groins, even around the head. Once you're in the hospital, we have some devices that are more formal or sophisticated in cooling blankets, and then another device that's actually inserted into the main vein of the abdomen that exchanges heat internally very aggressively. So we will also institute other sedative drugs to kind of calm the brain's actions, and also muscle paralytics, paralyzing drugs to prevent shivering, which is a natural response, but that consumes oxygen, so you don't want that taking place. So in addition to the natural coma that the patient's in, the drugs will help, blunt any feeling of discomfort or, that you're actually cold. Therapeutic hypothermia has not been widely adopted. It's one of these unusual therapies in our world, which we see often with a lot of novel therapies. It's been around and accepted for almost a decade, but has been slow to evolve into common practice. And it's one of the things that we're dealing with from a medical education standpoint, is to get this therapy out to the public and get it instituted in a timely manner.
Insert in Ecuador, the growth of similar incidence of infection and serious arrhythmias and well as in Ecuador, the growth of similar incidence of 28 and serious arrhythmias and well as similar use of blood products and 28.
Cardiac arrest, CPR, defibrillation. These terms evoke a sense of drama, of medical urgency, and of the boundary between life and death. This boundary between life and death indeed holds many mysteries still to medical practitioners in our modern times. Over the last several decades, we've learned a tremendous amount about better ways to resuscitate people from cardiac arrest. We've learned better approaches to CPR, or cardiopulmonary resuscitation. We've improved our ability to use electrical defibrillation or electrical shocks to bring people back into the world of the living. I'm Benjamin Abella, a physician here at the Trauma Center and Department of Emergency Medicine in Philadelphia at the Perelman School of Medicine. My specialty, that of resuscitation science, focuses on this issue of how to bring people back to life after their heart is stopped. The course will describe this topic of cardiac arrest and bring to bear some of the cutting-edge science that relates to how physicians, paramedics, and other emergency practitioners bring people back after their heart is stopped. In this course, we will cover topics such as how to perform CPR and what is the science behind chest compressions and mouth-to-mouth breathing. Should we do CPR on everyone with cardiac arrest? When do we use a defibrillator or do CPR, and what does the latest science teach us on these topics? We will talk about automatic external defibrillators, or AEDs, which many of you see in airports, gyms, and malls, and we'll talk about the science behind them as well. We will also describe some of the underlying physiology of cardiac arrest itself, and what do we mean when we talk about this boundary between life and death. Finally, we'll talk about some of the most exciting science around bringing people back to health after they have been resuscitated. Topics such as therapeutic hypothermia or whole body cooling to restore heart and brain function will also be covered. This course will introduce you to these topics in a broad survey fashion and will include examples from the latest research and also glimmers of where we're going in the future and how we will, in years to come, improve our ability to bring people back from cardiac arrest. Please join me as we explore this very exciting topic of resuscitation science.
Pros, cons. Pros, patients will wear older than 2 days and younger than 18 years of pros, patients will wear older than 2 days and younger than 18 years of where longevity or therapy higher temperature 36 and 32 years or therapy patients with that could be evaluated the chance in the mouse and the score from with that battling could be evaluated the chance was not significantly the score from B battling to 30 and 1 year was not survival was similarly different B 30 and 1 year's survival was similar.
Cooling the body, or therapeutic hypothermia, is a medical treatment that lowers the body temperature of a patient to minimize damage to the brain, heart, and other organs. At The Ohio State University's Wexner Medical Center, therapeutic hypothermia is being used on patients after cardiac arrest in hopes of maintaining brain function.
When a patient suffers a cardiac arrest, there is decreased blood flow and decreased oxygen supply to the brain, as to all the organs. That decreased blood flow and oxygen supply to the brain leads to brain injury, including loss of the capacity to think and motor skills. What's been learned with inducing hypothermia, you slow down the metabolism of the brain, therefore decreasing its need for oxygen and preventing brain cell injury.
People who suffer a cardiac arrest episode can be revived. A big concern, however, is always the length of time some of these patients have been without oxygen to the brain. This lack of oxygen can lead to irreversible brain damage, but this process of cooling the body is bringing success.
We've seen amazing results with patients that otherwise may not have survived, or if they did survive, would have severe neurologic impairment.
The key to success is getting the patient to the hospital quickly and having a medical team of doctors, nurses, and pharmacists in place to begin the cooling procedure.
We start using cold fluids, and we also will put ice around the patient's large vessels. So we'll put it around their neck and their brain and their head, and also around their, also in kind of their underarms, as well as at their groin. And our goal is to cool them relatively quickly.
The patient is sedated and given pain medication so they feel no discomfort or pain. The medical team closely monitors the patient for 24 to 48 hours during the cooling process, giving the body time to recover. Tracy Crockett is a therapeutic hypothermia success story. The 42-year-old mother of 3 went into cardiac arrest in July of 2010. Her husband Nathan administered CPR while daughter Megan called 911. Nathan still gets emotional when he remembers that day.
I just, I didn't really know what had happened. I just know she had stopped breathing. And I had asked Megan to call 911, and I continued CPR until the paramedics arrived, which, like I said, it felt like an eternity. But I held it together until the paramedics got here.
Tracy lives in Lancaster, so she was first taken to Fairfield Medical Center before being flown by MedFlight to the Ohio State University's Wexner Medical Center. It's the partnerships between Ohio State's Wexner Medical Center and surrounding hospitals that enables this cooling process to work for cardiac patients like Tracy.
As part of this program to make an awareness to the outside emergency room, so smaller hospital, smaller emergency room, a patient comes with a cardiac arrest, as part of our protocols, they know that we are going to induce hypothermia. And in fact, although they may not have the sophisticated equipment in their emergency rooms, we will induce hypothermia with just cold ice bags under the arms and the legs, and actually begin the process until the patient arrives here at OSU. So they're actually a partner in inducing hypothermia in the emergency rooms outside.
Tracy was in a cooled state for about 24 hours. She emerged from hypothermia without any memory of her cardiac event, but she could remember everything else. She could think, talk, and move, and she's grateful.
It's just kind of like the whole ordeal of everything that I went through. I don't remember that, and then for some reason just the day before I kind of lost, but other than that I remembered everything. If it does what it did for me, it's so well worth it.
We've had cases where they come back to our, to the units, and they'll come back to see the nurses and see the people that have, helped take care of them, and they come in, they give you a big hug, and they're like, I remember seeing you. I mean, I don't remember everything about it, but I thank you so much. And those are the things that, I mean, I can't even really put into words how good that feels.
Conclusion. Colmato children were survived of hospital cardiac arrest. Therapy hypothermias as compared survived of hospital cardiac arrest. Therapy hypothermias as compared with survived functional maternal did not offer a significant benefit in survived with a good functional outcome and 1 year.
I'm gonna have you scoop.
21-year-old Jay Eam is recovering at Ronald Reagan UCLA Medical Center after collapsing in full cardiac arrest while running the recent LA Marathon.
I went from running for the LA Marathon and then suddenly, like, just kind of fighting to live.
Good for you. Finally out of that bed.
Jay's life was saved by an uncommon twist of fate. 15-year veteran LAPD officer Joshua Sewell was at milepost 18 when Jay went down.
That's usually about the point, people start to get dehydrated and their legs lock up and so forth. So we figured it was just another case of, dehydration or muscle fatigue or something like that. I took a pulse at that point. There was no pulse, no breathing. Rolled his eyelids back. His eyes were rolled back into his head. So he was in full cardiac arrest at that point.
Officer Sewell immediately began CPR.
How are you, sir?
Much better.
And UCLA physician and professor of surgery, Dr. Charles Chandler, just happened to be 50 yards from the scene.
I was on my way to work, but decided to stop by as a spectator. I just made a quick assessment of how he was, what the likely problem was, and who was doing what, and how well they were doing it, and what he needed, and how to get him out of there.
Jay was rushed to Ronald Reagan UCLA Medical Center, where fate again intervened. UCLA is one of only a handful of hospitals equipped with a sophisticated thermo-cooling device that doctors could employ to again save Jay's life.
Most people who have cardiac arrest out in the field, as we say, on the street, don't survive. Most. The catheter comes in here. So this is a machine. It's a cooling instrument, which consists of a catheter that goes into the blood vessel, and it's a catheter that basically circulates cold fluid inside of this blood vein, and that allows you to cool the blood like a radiator cools a car.
UCLA helped to develop this technology that puts the body into a state similar to hibernation, protecting it from damage. Jay was placed in a coma-like state and cooled to 89 degrees Fahrenheit for 3 days, then slowly brought back to a normal temperature.
He's not had any real sign of permanent brain damage, so this therapy really saved him, and he's doing excellent. Put your hands up like this.
I haven't heard of them using it before, so I'm actually surprised that it works so well, so I'm completely grateful for that.
It's amazing. It's amazing. Every night I always called to check up on him because he was just like, we were rooting for him, and so it was such a beautiful recovery for him.
Jay is expected to make a full recovery. He's a pre-med student who plans to become an ER doctor. And Officer Sewell, who is also a runner, says whenever Jay's ready, he will strap on his running shoes and they will finish the last few miles of the marathon together.
Absolute miracle. It was, the marathon itself is near and dear to my heart. I ran it in 2006, and being able to, assist another runner like this is just beyond words.
Thank you. Thank you.